This segment is sponsored by Children's Hospital of Richmond at VCU.
The doctor is in and you have questions. The FDA has granted an emergency use authorization allowing adolescents ages 12 to 15 to get the COVID-19 vaccine. Another giant leap forward in the fight against coronavirus. Dr. Emily Godbout, an epidemiologist and infectious disease specialist at Children's Hospital of Richmond at VCU, is with us. It's great to see you. She's ready to address some of the common questions that parents have about the COVID-19 vaccine for adolescents. Dr. Godbout, wonderful to see you.
So nice to see you this morning.
This conversation is moving forward so quickly. My first question, this vaccine is available for kids ages 12 and above. How do we know it's safe?
So before the FDA grants an emergency use authorization for any vaccine, the vaccine has to undergo a rigorous clinical trial. So specifically for the Pfizer vaccine for our kids ages 12 to 15, there was a clinical trial with over 3,300 kids enrolled. They found that the vaccine was not only 100% effective at preventing symptomatic COVID-19 infection, but also that it was really safe. Multiple federal partners had to look at the data and all agree that the vaccine was safe. And this is what they did with the emergency use authorization.
Wow. And in your experience, it seems adolescents typically aren't developing severe COVID-19 symptoms. Why do they need to be vaccinated if that's the case?
So you're exactly right. Our adolescents don't develop severe symptoms, but they can, and a subset of them do develop severe symptoms. And then they also can develop some complications such as the post-infectious inflammatory process called MIS-C, albeit rare. So even though they don't necessarily get super sick, it's still important to vaccinate our adolescents to halt the spread of COVID-19. We really need to vaccinate everybody who's eligible, and we can help protect ourselves, our neighbors, our friends, and our community to really stop the spread.
Dr. Godbout, in addition to that first question of is it safe, the other big question that you hear very rapidly about the vaccine for ages 12 and above is, can this vaccine impact fertility?
So I know this has been a rumor that I've heard a lot, and I'm a mom to two young girls, so it's something that I think about, but there is absolutely no scientific evidence to suggest or support that the COVID-19 vaccine can affect fertility. In fact, multiple professional organizations for women support women who are planning on getting pregnant and getting the COVID-19 vaccine.
Dr. Godbout, we have about a minute left. I have a question for you about this COVID-19 vaccine being required for school in the fall.
So that decision is ultimately up to individual school districts. I don't anticipate that that will happen with our local school districts because our younger children are not yet eligible and the vaccine is still under emergency use authorization, but it's something that we're watching closely.
That makes sense. And Dr. Godbout, where is the best spot kids 12 and above can get the COVID vaccine? I guess maybe not best spot, but how readily available is this now?
So first step, I would check in with your pediatrician or your primary care provider to see if they have it available. We have it here at the Children's Hospital of Richmond for children and up to 2 of their parents or caregivers. You can also get your child registered on the Virginia Department of Health website to see when they can be next in line to receive it.
Great information. Thank you for sharing with us, Dr. Emily Godbout. Great to see you.
Good to see you too.
We'll share a little more information so folks can learn more. Visit chrichmond.com. You can also call 804-828-CHOR. That's 804-828-2467. And stay right here. There's much more Virginia This Morning coming up.